Hey guys, it's Sarah here. In this video, I'm going to be talking about troponin. I'm going to be talking about what it is, what causes it, the different types, delta, etc. So let's get started. So what troponin is a group of proteins that are found in the cardiac and the skeletal muscle fibers. And they play a crucial role in regulation of the muscle contraction. And so most people, when they talk about troponin, they're talking about in terms of cardiac, in terms of the heart. So in terms of the heart, when we're talking about troponin, we're thinking about the regulation of muscle contraction of the heart, so the heart muscle. And when the heart is stressed out or damage to the heart or lack of oxygen to the heart, the stress to the heart, it's going to release troponin into the blood. So that's why it's a good biomarker used to aid in the diagnosis of acute myocardial infarction, also known as a heart attack. There are two different main types of troponins that we're talking about when it comes to the heart. We have troponin I and troponin T. They're both going to be released, like we said, when there's damage, but the key difference is troponin I is only present in cardiac muscle and troponin T is also present in skeletal muscle. So that's why troponin I is more specific. And the troponin levels will generally rise within the first 2 to 3 hours. After cardiac injury, they remain elevated for around 1 to 2 weeks, with a typically maximum around 18 hours after the injury. And recently we have something known as high sensitivity troponin or HS troponin, and it's more sensitive than typical troponin just because you could detect it more earlier. So previously people were diagnosed with unstable angina because troponins were normal, but now they correctly could be diagnosed as NSTEMIs, etc. But the main thing with troponin is not actually the number, it's really the rise or the change. And that's why we have troponin delta, is the change between two consecutive, obviously they have to be, within a certain time, but it's a change between two troponin levels. So that's why it's so important for the troponin delta, because it's going to show that there's an increase as opposed to just regular high troponins. And some people could always have high troponins, like people with chronic kidney disease will typically have a high troponin. And that's why this rise or this delta is so important, because they could typically be elevated at baseline, and you don't want to see, but someone who has a rise would more like indicate an ischemia, an injury, some sort of stress on the heart as opposed to their baseline. So that's why the delta is very important. Lastly, I just want to mention that there are also other stuff that could cause an elevated troponin and not just ischemia or heart attack. There are other non-ischemic causes like myocarditis. There's also cardiac procedures could cause an elevated troponin. A fast heart rate could cause an elevated troponin like SVT or VTAC. And this is because it's so fast on the heart, there's so much stress on the heart, so it's releasing the troponin and it's going to be elevated. So troponin is not used alone to diagnose a heart attack. It's obviously used with other measures, but it's really helpful to use in terms of diagnosing or excluding heart injury, etc. So I hope you like this. If you have any question, please write in the comment section below. Thank you for watching.